Good afternoon. My name is Debbie Corman. I'm the Associate Director of InCHIP and very excited to host this, block my view, to host our InCHIP series of panel discussions on COVID-19. This is the fourth in the series. It's our final one for this semester. It's focused on the effects of COVID-19 on child caregivers. And this is the fourth in the opportunity for research teams that we funded to present their preliminary findings on COVID. We funded 20 very diverse projects of this over the last several months. And so these panel discussions are an opportunity for people to hear about the preliminary findings. We have recorded the previous three panel discussions on emerging adults, on messaging and communication, and vulnerable and at-risk populations. And you can go to InCHIP's YouTube webpage to see the recorded discussions. So there are going to be three presentations today. I ask you to remain muted throughout the presentation. We're going to save all the questions until the Q&A period, or you can enter them into chat as you go along. So I'm very happy to introduce our first presenter, who's Olivia Derella. She is one of the PIs on this project. She's a graduate student in psychological sciences. Jeffrey Burke, he's an associate professor of psychological sciences. He's the second PI on this project. And an additional team member is Emilie Butler, who's a graduate student also in psychological sciences. And the title of the presentation is Healthy Transmission of Coping During COVID-19, the Impact of Emotional Characteristics on Caregiver and Child Response. I turn it over to you, Olivia.
Thank you so much. As I pull up my slides, I just want to really express my gratitude for the funding as well as the opportunity to present these findings. Having dissertations slowed down with COVID, it was exciting to have this opportunity to really take another look at the sample that I had already been collecting for my dissertation project. And as a clinician, I'm actually working with kids and families who are living in the New York City area right now. So this topic is really important both to my work and also, just to my passion of really serving and better understanding kids and families at risk. So I'm going to jump right in. And let's make sure these are going. Okay, so as COVID-19 stretches into its 8th month as a global pandemic, we've really begun to document, research across the world has begun to document the vast mental health impacts for both adults and children. So in the US, we're seeing this marked increase in adult depression rates, and we're also seeing these specific forms of stress that are particular to caregivers. So parents are working from home or may have experienced losses of jobs, and they're also often becoming teachers and full-time 24/7 caregivers for their kids who are also home. And what we're seeing are actually these cascading effects by which parents' emotional traits shape their individual reactions to COVID-19. And then that then shapes their parenting behaviors and their children's adjustment. And so to understand how children are faring during this pandemic, we really want to first look to their parents. And this subject is something I've been interested for a long time. And so my UConn Feelings and Family study sought to understand pre-pandemic how parents' emotional traits and behaviors impact their children's emotional experiences, expression, and regulation. And I was particularly interested in understanding this for kids who are prone to irritability and anger. So we were recruiting a split sample with kids with elevated and low rates of irritability in the UConn area. And so baseline data collection was over the past year prior to the pandemic onset. And kids and parents came into the lab to complete questionnaires as well as frustration tasks to measure their kind of frustration proneness and reactivity. So COVID-19 gave this, this opportunity really to understand how parents' pre-existing emotional traits and behaviors shaped their response and then their children's adaptation to this novel chronic stressor. And so in particular, We can look at these domains of frustration reactivity as well as parents internalizing symptoms before the pandemic and understand how that shapes parents coping with COVID-19 stressors and also how they encourage their children to cope with COVID-19, what we call socialization of coping. And so coping can fall into adaptive or maladaptive behaviors. And we want to understand, are parents encouraging their kids to kind of approach and use problem solving with the stressors that they're facing, or are they tending to encourage them to use avoidance, which in the literature is usually associated with less adaptive outcomes? So we're looking now at time 2 during COVID, what symptoms are parents experiencing and what symptoms are children experiencing above their baseline levels pre-pandemic. And so in terms of the sample that we're working with, we had 45 parent-child dyads who were recruited prior to the pandemic, and it was split about a 1-to-3 ratio of irritable to non-irritable kids. And these were recruited from the Stores and Hartford greater areas. It's a predominantly white sample and highly educated. We were capturing mostly mother-child dyads. At follow-up, we had quite good retention, so 87%, although it is quite a small sample. And we had parents complete follow-up surveys, and parents and children were compensated at both time points. So just for context, the majority of parents completed our follow-up study from June 1st to July 1st this past summer. And that was as Connecticut was moving from phase 1 reopening into phase 2, and COVID rates were stabilizing, but schools remained closed. So that's just some context for what was going on in these families' lives, as I'm sure many of us remember. And so I'm going to kind of dive right into the results that are preliminary for this study. And I just want to mention that given non-normality of these clinical outcomes, we are using generalized linear modeling and some non-parametric tests to adjust for a kind of appropriate outcome distributions. So I'm going to just start off by talking about changes that we see in mental health during COVID-19, and I'll start with an encouraging finding. We actually saw no significant change in child symptoms from pre-pandemic to COVID-19, and that's in anxiety, depression, irritability, and oppositional behaviors. So that was heartening even within this small sample. In stark contrast, we're seeing markedly higher rates of depressive and anxiety symptoms in parents. And I just want to call your attention to the fact that within our sample, 88% of parents showed higher levels of depression during the pandemic compared to before. And this average score here of 13 at time 2 during COVID is really close to that clinical threshold of 16 on this measure. So, and we're seeing anxiety on average in the mild range. So we're seeing these elevated clinical symptoms. And I was really interested in exploring more about parental depression, since we see lots of impacts of caregiving on maternal depression particularly. And so I wanted to understand which parents are most at risk of experiencing worsening depression during COVID-19. And what we wanted to do was look at how are parents coping with COVID-19 stress, and then how does that affect depressive symptoms above baseline levels. So we wanted to assess these coping behaviors that are considered to be less adaptive, and these are reactions to stress. Some of these are not even quite coping. But what we found was that after controlling for baseline levels of depression, parents who were engaging in more distraction strategies to manage their stress, or who tended to blame themselves more, were experiencing higher rates of depressive symptoms during COVID-19. So these are two risk factors that we want to think about for these parents who may already be experiencing some depression at baseline. I also wanted to understand the role of frustration reactivity. So if you can imagine somebody who's highly prone to frustration, you're very easily annoyed and upset by stressors. If you're experiencing high levels of impacts of COVID-19, we might expect that interaction to kind of worsen your adjustment and maybe even predict higher rates of depression symptoms. So that's what I wanted to understand for a few different domains of COVID impacts. We looked at the interaction between parent frustration reactivity and the kind of restrictions imposed by quarantine. And what we found was consistent with expectations, whereby for parents with high frustration reactivity, so this dotted line here, we're seeing that for those who have more quarantine restrictions, we're seeing the highest levels of time to depression, controlling for baseline levels. And for parents who had low frustration reactivity, quarantine impacts didn't have that kind of differential effect. I also was really interested in caregiving burden, since parents are taking on all of these new roles as parents, full time every day. This was actually contrary to what we expected. So we actually found that for caregivers who are experiencing high levels of caregiving impact, so lots of caregiving burdens, there is no differential effect based on frustration reactivity levels. So regardless of frustration proneness, parents were kind of showing similar depression scores when they had high caregiving burdens. In contrast, we actually see parents who have high frustration reactivity were experiencing elevated depression in the absence of more caregiving burdens. And so this is an effect we're still trying to make sense of, but it may be that there's some protective effect for these parents of being busy with caregiving. You might imagine like the emptiness of quarantine without much that you're doing as a parent. There may be just kind of higher risk of anhedonia or other depressive symptoms beyond kind of the stress that you'd be experiencing. We also looked at whether social losses predicted differential impact based on frustration reactivity. And we found kind of globally, parents who had more social losses, like canceled events or lack of contact with loved ones, were experiencing greater depression at time 2, with no differential impact based on frustration reactivity. So next, we wanted to just understand, what are parents doing to help their children adjust to the stressors of COVID-19? And how does that then affect kids' symptoms? So we looked at these 4 domains of suggestions that parents might make for their children to cope with the stressors of COVID. And these top 2, the engagement, coping, and cognitive restructuring, are what we typically think of as adaptive coping suggestions. We actually found that cognitive restructuring, consistent with hypotheses, was associated with lower irritability and depression. But contrary to what we expected, we saw that behavioral avoidance was also associated with lower rates of symptoms during COVID. So it may be that in the context of a chronic stressor where there are not so many things you can do to change it, behavioral avoidance is an adaptive strategy. And consistent with what we would expect, cognitive avoidance was associated with higher irritability and depression. So telling kids, just pretend like it's not happening. That doesn't seem to work, and it makes kids actually feel worse, or it may be a contributing factor. And child anxiety actually was not associated with parents' socialization of coping. So just to kind of temper the generalizability of these conclusions, we know this is a very small sample, but we do have a snapshot of families who are living in our area, who have majority high education levels, high socioeconomic stability. And for these families, we are seeing that despite COVID-19, and as schools remained closed throughout Connecticut in May and June, kids' emotional and behavioral difficulties are no different from baseline. So while it's maybe isolated, it's still encouraging to see. We also found that parents' encouragement of certain coping strategies may be protective for kids' irritability and depression. So there are things parents could do that might help reduce the risk for their kids. In stark contrast, as I mentioned before, we saw this dramatic effect on parents' emotional distress, where parents are feeling worse than they were before COVID-19. We also identified some risk factors. So parents who are engaging in self-blame or avoidant coping, that may exacerbate their risk for worsening depression above baseline levels. And also parents who are more prone to frustration may experience COVID-19 impacts differently, and that may subsequently affect change in depressive symptoms as they adjust to COVID. So I think broadly, this gives us clear intervention targets and indicators of parent and child risk, even in a small sample. And with further research, I think we can understand the clinical implications and how we can apply this knowledge to the work that we're doing to support kids and families right now as COVID continues to persist. So I just want to thank everybody for listening. It was really exciting to be able to present this for you today. And again, I want to express my gratitude for the InCHIP Rapid Release Grant. I also want to say I really miss my lab now that I'm in New York, and just wanted to send show our group photo from our last lab meeting during COVID before I started internship. So thank you so much for your time. That's what I've got here.
Thanks, Olivia. That was a really interesting presentation. I think I agree with you. I think there are a lot of implications for how to intervene with parents based on that. Hopefully, we'll have some time to talk about it further. I want to turn to our next presentation by Emilie Iovino, who's a postdoc in educational psychology. She is one of the PIs on this study, along with Sandy Chafouleas, who's a distinguished professor of educational psychology. The title of her presentation is Impact of COVID-19 on Primary Caregivers of Children with and Without Developmental Disabilities. Go ahead, Emilie.
All right. Thank you. So to echo Olivia, we are also so grateful for the funding from InCHIP that supported this work that I'm excited to share with all of you. So prior to COVID-19, caregivers of children with disabilities have demonstrated challenges with maintaining health and well-being as a result of chronic stress. So these challenges, as one can imagine, have been exacerbated during the COVID-19 pandemic. Initial findings from other work during COVID-19 suggest concerns for all caregivers. And family life has changed drastically, particularly for caregivers of school-aged children who have been tasked with managing their child's education from home. Family caregivers have faced balancing multiple roles and responsibilities, and for many caregivers of children with disabilities, this schooling from home has meant not only balancing their daily caregiving tasks, traditional parenting responsibilities, work obligations, and homeschooling, they may also be faced with implementing specialized instruction, related services, or behavioral interventions for their children. So these additional stressors on top of the existing concerns for the well-being of caregivers of children with disabilities is really cause for alarm, and sort of what led us in this direction to explore the impact of COVID-19 on caregivers of children with disabilities. So to set the stage for how the methods and results are presented, here is a look at the timeline of the project. So first, participants completed initial surveys in April 2020. A selection of interested survey participants completed follow-up interviews during May, with the final interviews completed in June of 2020. And follow-up surveys were distributed to participants in September, with the survey being closed in October of 2020, so just a couple of weeks ago. So in terms of the survey methods, between April 1st and April 15th of this year, a total of 460 caregivers from across the United States completed an online survey using Qualtrics, with recruitment and survey completion occurring simultaneously. 53 participants were excluded as they did not meet eligibility criteria, leaving a sample of 407 participants. Of the total sample of eligible participants, 225 were the caregiver of a child with disabilities, and 182 were the caregiver of a child without disabilities. Eligible participants were required to be at least 18 years of age and to be a primary caregiver of a child between the ages of 6 and 18, which we deemed to be school-aged. So caregivers included two groups, specifically caregivers of children with moderate to severe behavioral challenges who were diagnosed with autism spectrum disorder and or ADHD, and caregivers of typically developing children. Measures included a demographic questionnaire, questions that we created to explore COVID-19 exposure and impact, the short form for the burden scale for family caregivers to evaluate caregiver burden, and the 21-item version of the depression, anxiety, stress scales to evaluate psychological distress. Data were first analyzed using descriptive statistics, and then to compare the experiences of caregivers of children with and without disabilities. Independent samples, t-tests were conducted for continuous variables, and chi-square tests of independence were conducted for categorical variables. So the majority of participants across groups were white, non-Hispanic, between the ages of 35 and 44, identified as female, were married or in a domestic partnership, and were employed full-time. The majority were also the sole provider of care for their child, were identified as the parent of the child they care for, and also had at least a 4-year degree. So this is a, largely white, middle to high SES group of individuals in this initial survey. So survey participants who indicated interest in participating in an interview were categorized into 4 groups based on child age, their child disability status, and severity of behavioral challenges. So within each category, 10 participants were randomly selected to be contacted for an interview. A total of 30 caregivers ended up completing semi-structured interviews, 13 of whom were caregivers of children with disabilities, and 17 of whom were caregivers of children without disabilities. All participants were interviewed using a semi-structured interview protocol that we designed to explore experiences of stress associated with caregiving, their personal assessment of their self-care practices and personal well-being, and their support needs as a result of the pandemic. Interviews were conducted virtually, of course, given the nature of the pandemic, and were audio recorded and transcribed. So then to analyze the qualitative data, participant responses were coded using Braun and Clark 6-phase approach to thematic analysis to determine themes across and within groups. So with regard to the interview participant demographics, given that these participants were from the sample of survey respondents, it's no surprise that the majority were also female, white, non-Hispanic, between the ages of 35 and 44, married, or and employed at least part-time. However, the majority of interview participants were actually not the sole provider of care and most frequently shared caregiving responsibilities with a spouse or partner. So that's a little bit different, that this subset of participants had additional support or identify themselves as having additional support for caregiving. So on to the initial survey results. So the majority of participants indicated that their child's school building was closed, and this is, again, setting the stage back in early to mid-April. Their child's physical school building was closed, that their child's schools were providing remote learning opportunities, and that they were the individual responsible for facilitating remote learning. Across groups, at least 32% of participants indicated no known exposure to COVID-19 at that time. 6% of participants across groups indicated that either themselves or a family member living in the home had been infected with the virus. And unfortunately, 12% reported that they had lost a loved one as a result of COVID-19. So participant ratings of the individual and family impact of COVID-19 indicated at least a slight impact in all areas. And results of chi-square test of independence indicated that there was a statistically significant relationship at the 0.01 level between having a child with disabilities and reduced supports for their child's educational goals, lack of resources to assist with childcare, and increased financial strain. There was also a statistically significant relationship between having a child without disabilities and an inability to see friends and family per usual. All caregivers did note that their psychological worry increased and opportunity to engage in self-care decreased, at least somewhat as a result of the pandemic. However, there was not a statistically significant relationship between whether their child had a disability and either of those variables. So this graph represents the mean scores on each of the scales, so the burden scale for family caregivers and each of the 3 scales within the depression, anxiety, stress scales, with the blue bars representing scores for caregivers of children with disabilities and the yellow representing scores for caregivers of children without disabilities. Results of our independent samples t-test indicated that caregivers of children with disabilities reported experiencing significantly higher levels of caregiver burden, depression, anxiety, and stress than caregivers of children without disabilities, all at the 0.01 level, with small to medium effect sizes across variables. So moving into our interview results, I want to preface that there are representative quotes throughout the slides, but in the interest of time, I'm not going to read them, and hopefully all of you have a chance to read through them as I go through and kind of present the main summary points. So as you can see, across caregivers of children with and without disabilities, concerns related to remote learning and their child's school were among the greatest, if not the greatest, source of stress resulting from COVID-19. So for caregivers of typically developing children, supporting their child based on the school's expectations for remote learning was really challenging, and not really being sure about what those expectations were and how to support them. For caregivers of children with disabilities, it was really trying to, again, replicate those special education services at home. So trying to kind of embody the role of all of these trained professionals in meeting the needs of their child. Okay, in terms of self-care, although all caregivers did express challenges related to their personal self-care, specific challenges came up for each group. So for caregivers of typically developing children, it was really around access to resources in the community to support their self-care, like going to the gym or just even being able to go outside and go to a park. Whereas for caregivers of children with disabilities, it was sort of kind of a persistence and exacerbation of pre-existing challenges around self-care. So really kind of voicing that there wasn't time to do things previously and there still isn't time as a result of the pandemic. And again, this is back in, at this point, May and June. With regard to support needs, as with the primary sources of stress across groups, these support needs identified by caregivers largely centered around their child's schooling and wishing that they could have had more preparation from the school in supporting their child's schooling, information and resources to support both the academic and emotional needs of their child. And then for caregivers of children with disabilities, really wanting some of that respite care that schools often provided for them, along with support around delivery of school-based related services. So again, that school psychology, speech therapy, occupational therapy, physical therapy, and then really wanting some explicit guidelines and expectations for homeschool communication. At the end of the interview, caregivers expressed some additional concerns that were not explicitly asked about. And across groups, caregivers expressed concerns about the negative impact of the pandemic on child well-being. And in particular, caregivers of children with disabilities really re-emphasize caregiver burden and the lack of supports to address this burden for caregivers specifically. So really wanting more supports targeted towards them. So our follow-up survey analyses are currently underway as the final responses just came in a few weeks ago, but information on how to keep up to date will be on the last slide as these findings come out. So before I go into the key takeaways, I would be remiss not to mention that the study was certainly not without limitations. For one, the groups of participants were not equal, with more caregivers of children with disabilities completing the survey. In addition, the fact that the majority of participants were female, white, non-Hispanic, and middle to high socioeconomic status certainly limits the generalizability of findings. The lack of racial and ethnic diversity is particularly problematic since COVID-19 has had a disproportionately negative effect on Black, Indigenous, and people of color, which should certainly be taken into account when interpreting our study findings. So with that said, the key takeaways are really first that all caregivers are experiencing challenges in these domains. The second is that, at least for the initial impact of COVID, there was a greater impact that was more negative for caregivers of children with disabilities. Third, that challenges related to their child's schooling were cited across groups as a major, if not the primary source of stress. And finally, that caregivers of children with disabilities faced greater challenges related to supporting their own self-care than caregivers of children without disabilities. So thank you. Here's where you can find more information and keep up to date as we, again, get those follow-up survey findings analyzed and out.
Thank you, Emilie. Again, a really important study and interesting presentation with lots of potential implications for how to intervene with caregivers. They are clearly having a lot of struggles doing this homeschooling. Our last presentation is by Lisa Butler, who's an associate research professor at InCHIP. She is one of the co-PIs on this study. The other co-PI is Phelgona Otieno, who is, she's at Kenya Medical Research Institute. And another team member is Leonie Marinovich, who is a consultant. We're going to be leaving the United States for this presentation in that Lisa is going to present findings on an exploratory study on the effects of COVID-19 and associated social and economic changes on children and their families in resource-constrained settings in Sub-Saharan Africa. So very much looking forward to your presentation, Lisa.
this is very much an ongoing study. So the work is, all of my work is based in Sub-Saharan Africa. And we've encountered quite a lot of delays. I think everybody appreciates the disruptions around the world to our work, but I think for a lot of us who have been doing work in settings outside of North America, we've experienced I don't know, even more delays. So what I'm going to report today is just on just a portion of this project, which will continue over the next couple of months, which has had its sort of unexpected benefits, which I can mention at the end. So as everybody knows, March 11th is the date that the pandemic was announced. And, in the settings where I work in, in Southern and Eastern Africa, it was met with, some degree of, I guess I want to say like disbelief, but I think overwhelmingly it was met with really a swell of a response from partners around the world. Right away, there were efforts to develop messages. I think we were all very aware that as much as many of us have access to news channels and so on 24 hours a day, and we were getting sort of moment by moment updates for what was going on. But many of us were aware that there were many people who did not have that kind of access to information, and we wanted to get the word out. So very quickly, materials were created. I was quite involved with that right away, and partners. I'm sort of showing just a little clip of one thing that was developed from partners in South Africa, Jive Media Africa, who produced cartoon graphics, to explain what coronavirus is, and to show things sort of like preventive measures, and then very rapidly move to translate these materials. And that very same time, in those first days, I don't quite remember when an opportunity came to propose a study for this InCHIP. But I feel like it was sort of a flurry of activity at that very same time. And, I think, again, I and everyone else anticipated, sort of the many effects that this could have on the communities where we work worldwide. And so the objective of our study was to evaluate sort of the impacts of COVID-19 and associated mitigation strategies on families, children and families. And there are two parts of our study, and one part being sort of this is a primarily qualitative study, examining these impacts from the perspective of government, non-government, and community-based organizations, as well as members in civil society, as well as caregivers of young children who have been working with for the past 4 or 5 years in Western Kenya. Today, I'm going to present part of this, which was from our interviews, again, which are ongoing, but with some participants from government, non-government, community, and civil society. So for the past few weeks, we've been conducting in-depth, semi-structured interviews, all conducted by teleconference. And in these interviews, which have lasted approximately an hour, we've explored, issues, sort of the many effects that are related to COVID-19 and mitigation strategies, as, on their organization and on, their observations and experiences, directly with the children and adolescents and families who they serve. I want to say, sort of, as much as we're focused on children, it became very quickly that we, that it became, I don't say, it's necessary to explore sort of the many effects, and very broadly speaking, because the things that are affecting the communities and the adults are, these are the very factors that are going to have had and will have effects on young children. So Sub-Saharan Africa seemed to have perhaps the luck of seeing its first cases a bit later than many of us did in North America. So as people were hearing the news, in March and even into April, even into May, people were hearing about how the world was shutting down, and the same measures were being applied in cities throughout Sub-Saharan Africa, but no one knew about cases. There were no cases, and so it led to quite a bit of suspicion, and it also sort of gave way to a lot of misinformation. So this is just one quote of many. Everyone we've spoken to has talked about the problem of misinformation. So early January, that's when I started hearing a lot about COVID, and we didn't really have cases. That's when a lot of information, a lot of fake news was being fabricated, that it's not an African disease, it's just targeting rich people. So needless to say, some of this kind of rhetoric and beliefs, it affected the way people reacted to, at least in some settings, to the recommendations that were being made by governments. It just simply didn't make sense. But then, of course, the lockdowns happened, and they started, it's different for the different countries, but in general, they started by late March, early April. So in Namibia, when respondents said the first lockdown happened in March or April, that's when we went to lockdown for 2 months. We first started with 2 cases, and the country went into complete. Nothing was moving. Children were not at school. People were not going to work. So that's actually when things started getting very serious. But still, misinformation just spread through communities like wildfire. And, it seems like in those first months, it seemed like I was responding to quite a lot of questions and requests and so on that relates to how do we battle this misinformation that's happening. So again, these are from respondents in Namibia. One says, funny enough, when people were tested first, they were not Namibian, they were Romanian people. So the people continued with fabricating a lot of fake information. That it really is not meant for poor people. It's not meant for Black people. But here, this quote is from a woman who's leads a community-based organization. And she says, that's when I also realized, through her own reading and so on of the guidance, that's also when I realized that this is an outbreak that has no color. It can just get to anybody. And the thing was, among us, we also thought that people who are HIV positive, which were at much higher risk than the others. But when more information started coming out, more education being shared that anybody can get it, elderly people needed to take care, people with asthmatic and diabetic needed to take care, I realized that the chances that I have as a person living with HIV is equal to any other person. I think everyone knows about, sort of these immediate effects of COVID that have, affected everyone around the world. So again, our respondents in different countries, spoke about the impacts of unemployment. Here in Kenya, she says, so when COVID came, what has happened is that this population has been affected because of the restrictions that were placed by government to ensure that we don't have widespread of the disease. And most of the casual laborers then were forced to stay home. And yet they depend on lots of these. I mean, the short-term employment to be able to put food on the table. These are people who have families, they have children, and that, of course, has led to lots, most of these families, when you look at them, perhaps if they were eating a meal, 2 meals a day, probably they would be down to one meal or nothing at all. And in fact, we're working in settings where poverty and food insecurity are so widespread. Many families, not all, certainly, have very little cushion to fall back on, and so the lockdowns were sudden, with sudden unemployment, and for many families, their one breadwinner was suddenly employed, and there was absolutely nothing coming in. So people felt the effects very quickly. Very early on, we started also hearing about the impacts on HIV treatment. When the lockdowns first happened, there was everything just seemed to happen very, very quickly, and sort of the government response was just that. It was sort of everything was in a very kind of in a reactive stage, and so right away there was some confusion about if you can't leave the house and you can't go and get your medicine. And further, if you were to go, I think there was a response that people would need to carry a letter to explain why they would need to leave their home. And so, and that of course gave rise to, perhaps some unanticipated problems, such as the one reflected here. People, we're not even moving to go up to their follow-ups. If you are going to follow up, you have to show the police officer that I'm going to get my medicine. So there's an implication on confidentiality. Needless to say, in my own conversations outside of the course of this particular study, we know that that this very thing has led to people simply not going to their follow-up visits, not going to collect their medicines, and it has led to quite a lot of lack of adherence to their ARVs, at least in those first couple of months following the lockdowns. Another says, in South Africa, the day that COVID is going to show himself in rural areas, I'm telling you now, that is the day that me and you will have tears in our eyes, because it's the same situation that we saw with AIDS. Remember, I'm already getting treatment that is expired from one of the clinics. That doesn't sound nice. If you imagine what would be the results, the side effects of COVID in the real terms, real time, next year winter, when it shows off. And this is a reference to winter, which will start around April, so next year. Okay, so there are so many effects, and there's not enough time to talk about all of them, but I want to talk about the response from community organizations, the government, non-government, and individual people. There have been many, which initially the kinds of activities were, giving food baskets, food vouchers, seeds, assistance in planting home gardens. There's also, some, quite interesting and incredibly innovative things that have happened over this time, which I think will end up changing the direction of our work in the future. I'll talk about just a couple of those. One of the respondents in South Africa, talked about, not the handing out of goods, but, rather working with the community. So here the example is, we started doing sanitizers as a prevention so that people who don't have sanitation, the water is collected from a tank. Every household, every street has a JoJo, which is a kind of tank where people go to get their water. People did not have basins where they could wash their hands in water all the time. So I took these big 20-liter drums. I went to pick some lemons and Marico, because it's a citrus area, and rosemary, and a bit of jip, which is bleach, and drops of tea tree oil from Discount, which is a chemist, which I bought out of my own pocket. And then, because we were doing recycling of bottles and plastics, I took all the bottles that we were recycling, we cleaned them. And with young people from small village, I said, this is your community, and I'll help you do it. And so she taught everyone how to make their own sanitizer. And then again, I think examples with everyone I've talked to has talked about gardening interventions. Again, the respondent in South Africa talks about supporting young people to learn about gardening and cooking healthy meals and learning about permaculture. She says, this was an area where young people actually realized what the effects of what COVID could actually mean if we don't do what we can do to make sure we have food security. At the moment, now, just a few days ago, we've got about 45 households that got vegetable gardens. It's one home, one garden program that if they produce more, they can distribute it to those that really are in need of food and really during COVID. So one of the things that that has happened over this kind of expanded time that we were, prepared to do the project and finally being able to do this, at first it was like there was such an urgency to get seeds and to, assist people with planting and so on. And now what we're hearing is that there's just an abundance of, for those who took up, these kinds of initiatives, there's an abundance of food, and it has really opened eyes to a lot of people about what can be accomplished just out of home gardens and community gardens and coming together. So sort of very common theme that has come across all of our discussions is about sort of these positive things about coming together. And I think, we've heard that reflected, in conversations from North America, Europe, and here. So she says, it's also brought a sense of sharing amongst family networks in these areas. And she says, I think that advantage right now, with where South Africa is, particularly in areas like this, where families can work together. If Uncle so-and-so is actually not watering the little allotment, then, I don't have to go and speak to Uncle so-and-so, because the family themselves will go to Uncle so-and-so and say, look, you didn't harvest on time, you didn't put the seeds in, or your child didn't come to water. It becomes a family thing, a family unit. So there's so many different quotes I could share about this kind of thing, but here, I think it's we've heard so much about the opportunity to spend time together, working with each other, holding each other accountable for what happens in our own homes and communities. So these are all really positive things, and it's also led to a heightened sense of community awareness about what can happen in situations like this. And I welcome all of these. Of course, there have been a number of negative effects as well, and mental health and hopelessness is certainly one of them. Here, she says, what it's also done is to make young people in the area, especially those who have not reached their dreams, to think, well, what the hell? There's no point. The world is not going to change. You have the young people and the elders who have said, well, how am I going to do it? If COVID comes to us, we've got no way to defend ourselves, so it's kind of giving up. I don't care. It's also given rise in a lot of areas to xenophobia. It has, the lockdowns had so many different kinds of effects across the continent. One of which being that it kept people from out of cities, or kept them sort of trapped in cities. And for many, it kept, many people who are, in cities, who are migrant workers, from being able to go home, which has many, many effects on, those individuals and their families and their children. So I will just go ahead and pass here. It's also, everyone speaks about the rise in gender-based violence. In Namibia, 3 days would not pass without you hearing a woman has been raped, a woman has been caught with a panga. This has been some of the issues that we're dealing with before COVID, but during COVID, these cases become a lot. At some point, we're discussing in the WhatsApp group that we have, somebody posted a question, are we even safe? Even us who are married, are we safe? It's worrisome. You hear rape, you hear violence, you hear murder every day. It's like a normal thing for us. And I think, we're hearing about this in all corners of the world. Finally, the other thing that has, topic that has come up from every respondent has been about the observation of the rise of teen pregnancies. Many girls have not gone back to school because they've come out pregnant. Yes, we do have a provision of a child who can go back to school even if they're pregnant, but I think the pressure from their peers, some of them don't feel the confidence to go back to school. There's no one to stay with their children while they attend school. And another says, maybe we don't have the data documented yet, but we do have the evidence. If you go to this house, there's a child pregnant. The next house, there's a child pregnant. 10 miles away, there's a child pregnant. all those girls are just between age 14 to 16. They're supposed to go back to school, but they couldn't. Throughout many of the settings where we work, young women will present with their pregnancies quite late in their pregnancy, and it's only just now that that young women are starting to present. And so over the coming months, we can expect to see many more. But in data from rapid surveys and sort of very recent data coming out of clinics, again, throughout in many settings, but one of our respondents from Nairobi City Council, reported, that they are seeing, the numbers of teen pregnancies going up very dramatically. What we can also expect to see are going to be these, increased rates of STIs and HIV and so on. It's like we're just at the beginning of this wave now. So there are many different effects. All of these different things now have multiple effects on children living at home. I think we've had we're able to talk with the adults directly. So we can make we know that these many different factors will have effects, both short-term and long-term, on the young children who are in the households. These are, when they're young children who are in households where they're, witness to this, increase of violence within their household. We have young children who are in households that are, experiencing, the very, acute effects of food insecurity and poverty, as well as, of course, their disruption to their own education and caregiving and so on, which has been talked about, earlier in different settings, but the issues are, all very much the same. I think you're looking forward. What we as all of our teams are talking about is, how this is going to, what does all of this mean for, how we go forward in our programming and in our research and so on. And I think we all agree that, nothing is going to be the same. There have been so many innovations that have come out of this time. And many of those innovations are, have made use of technology in some incredibly innovative ways, which, I think we're going to start integrating, more of this going forward.
Hey, Lisa, sorry to interrupt, but we have very few minutes left, and I'd like to leave a couple minutes for questions.
Perfect. So that is all I have to say, and I'm happy to answer questions. Thank you.
Sorry about that. Thank you. Obviously, we could spend a lot of time on this. It's really interesting information, and I was particularly intrigued by some of the innovative ways that the community came together to try to address the challenges of COVID. But I want to give, we don't have a lot of time, so I want to give other people the opportunity to ask questions. I want to thank all of you for your presentations, all of them really fascinating. If you have a question, just unmute yourself. I'm not going to do the hand raising. So if you have a question, feel free to unmute yourself and ask your question. While we're waiting for questions, I think a really important question is, what are the implications of some of this work for interventions? There's been some really interesting findings about the challenges that people are facing, caregivers are facing. So, I'll direct it first to Olivia and Emilie. What are some of the implications from your studies? And please unmute.
Sure, I can start. I think one thing that I've observed and had been kind of a concern to me was seeing parents who were trying to kind of diminish or avoid talking about COVID with their kids, their younger kids, when the pandemic started. And this idea that, let's just kind of not talk about it and maybe it won't affect them. And like, we don't want them to think about it and feel more upset. And what we know is that that kind of strategy really, globally doesn't tend to work for kids, or even for adults. Like, if you try not to think about something that's upsetting, it usually comes back, and it kind of comes back in full force. And so I think that giving parents ways to help their kids, thinking about ways that they can help their kids cope in maybe more effective ways, I think that that has direct implications for people working in clinical areas, and really discouraging avoidance of conversations about COVID, or suggestions that kids, just, don't think about it. Like, let's just pretend it's not happening, or, try not to have those negative feelings. Like that kind of coaching doesn't really help kids learn to feel and then process and cope with and kind of move through the negative emotions that they have. And it can really foster worse mood.
Yeah, I definitely agree, Olivia. And I would say within the scope of thinking about schools and education, I think in a way, this has been a really unique opportunity to engage caregivers and families like never before through virtual opportunities for participation, increased access to communication with educators. But I think what we learned, especially from sort of the end of the spring, and I think a lot of schools and districts across the country have done their own sort of internal research to assess parent and family needs. And I think that, when thinking about interventions, especially for caregivers or children with disabilities, there's a lot of service considerations in terms of thinking about interventions and the adaptation to a virtual or hybrid environment, or even just the, sort of challenges of interventions are not being delivered as intended. Because even if they're in person, for the kids that are able to be physically in person, they're wearing masks, they're physically distanced, or if not, there's an increased risk. So I think there's a lot of things to think about through the lens of a school-based perspective. But I also, again, want to circle back to the opportunity that I think there really is a lot of opportunity to connect with and engage families and caregivers to support child outcomes and to support child well-being. And I think there's a lot of ways, sort of the lessons learned from the spring, that are, we're continuously evaluating and moving forward in terms of figuring out how to best support families. But I think if there is if we go full remote, which several places across the country have already, but just a lot of considerations for how to continue to support families. And really, I think going back to ask them, that was one of the biggest takeaways from our interviews, was that they want their voices to be heard, and they want to be able to openly communicate with the school and receive preparation and supports from the school. So that's sort of, I think, some of the biggest things to think about in terms of interventions, again, through that school-based lens.
Unfortunately, we're out of time. So I wish we had more time. This always happens at these panel discussions. We don't have sufficient time for actual discussion and questions, but I'm sure that if people have questions, they can follow up with the presenters. I want to thank Olivia, Emilie, and Lisa for really interesting presentations which I think have a lot of implications for moving forward. I will follow up with you with all of you with a link to where you can see all of the recorded presentations and panel discussions on COVID. And thank you again. And thank you for your support for InCHIP. Stay safe, everyone.
Thank you so much.
Bye.
Thanks, everyone.